Wellness Wednesday listeners. This is Helen Nguyen coming to you this Wednesday, this beautiful Wednesday here in Seattle, Washington. Wellness Wednesday is sponsored by 3W Medical for Women, a medical clinic that provides free reproductive health care services for women in the Seattle area. We're so glad you're joining us again today for another episode. Today, it's just going to be me, and I wanted to share with you some of my personal experience going to the doctors, and today I wanted to specifically focus on 8 tips to get the care you need when your provider is not listening to you. And this was inspired by an article I ran across on a website called naturalwomanhood.org. That's naturalwomanhood.org. And I just thought, wow, this really needs to be talked about because I experienced this. And I like to think of myself as a pretty assertive person, and being surrounded by medical professionals all my life. I have quite a few medical professionals in my family, as well as working with medical professionals for these last few years. And I thought, even I get pushed around sometimes when I go to the doctors. And I think, I don't know, I'm not alone. So I just wanted to highlight these tips and go over them with you and share my experience so that you are not alone, you're not crazy, and maybe we can just highlight some ways that we can get through these tough doctor appointments together. So the first tip that this article suggested was a pretty obvious one, but remain calm, because it can get very heated sometimes. I don't know about you, but sometimes when I feel like I'm not being heard, sometimes I feel when medical providers dismiss why I'm coming in for an issue, or, sometimes they're so busy that they're not even making eye contact with you because they have a computer and they're trying to chart and they're looking at the time, there's insurance and billing, and you feel pretty dismissed when you're going to the doctors. I need you, and I have to remind myself to do this too, to take a deep breath, to remain calm, and just continue to understand that there's a lot of different factors going on right now. And just to remain calm, maybe get some water, ask for a pause, ask for them to come back in 5 minutes so that you can compose yourself, whatever it is that gets you to a place where you can then communicate effectively again. The second tip that this article suggested was stand your ground. And I think that's awesome because, again, I'm a pretty assertive person, and yet I still get intimidated by my medical providers sometimes. And I think that's something that we do really, really well here at 3W. I want to mention, ever since I started, ever since we started seeing patients here, Dr. Rutherford is also my medical provider. And I just, people say that's so weird that your boss sees you as a patient as well. But I don't think it's weird at all because I trust her. I like her. I know what kind of experience I'm going to get, and it also gives me a glimpse inside what my patients are going to get when they meet with a medical provider here at 3W. And we try our best here at 3W to create a safe and non-intimidating environment so you can talk about very candid issues that you have when you're here without feeling like you're rushed or being pressured to do anything. So standing your ground when your doctor is trying to give you advice or some things to consider about your health is really important, because it's called practicing medicine. The provider still is not a walking internet resource where they know everything and everything. They need to still be able to go back and look at textbook stuff, look at studies, and they should be able to have the humility to say, I don't know the answer to your question or to your concern right now, but I'm humble enough to go back and research a little bit more, talk to some of my colleagues, and give you a call and follow up with you. And I think that's really refreshing to hear sometimes from a provider. So when you feel that their advice or the suggestions they're giving you just doesn't really align with your values or what you've heard, feel free to push back, respectfully, of course. Feel free to push back, though, and just because they have a medical degree doesn't mean they have authority over you or know everything, right? We're imperfect people. So that's such a great suggestion. Third tip is take pain seriously. This seemed really obvious to say out loud or to understand, but for the longest time, there's these stereotypes that, women take pain so much better than men and stuff like that. But however, this article points out that pain is an important indicator that something is wrong, right? We should not have to suffer in silence. There's a limitation, I think, everything in moderation from how much we talk about it, of course. But I think that we shouldn't minimize the pain that we're in. And specifically, from my personal experience, and I recently have been diagnosed with endometriosis and PCOS, so I've always had terrible, excruciating, debilitating menstrual pain. And it has started as young as my first period when I was 11 years old, and I'm 33 now. And there were times where I could not go to school, I could not go to work. I missed out on feeling normal, whatever that means. But I remember fainting on campus, on the UW campus, and having to be helped by just strangers to the nearby Hall Health Clinic, which didn't do anything. But that pain was very real to me, and it was very debilitating for me. And so making sure that your provider understands the degree of your pain and the degree in which it affects your life on a normal basis, on a daily basis, on a monthly basis, and helping them make sure that they take your pain seriously. So I thought that was really cool and important. Fourth tip was seek second and third opinions. And I love that because, here at 3W, you're able to spend an hour of your time with a medical provider free. If it's a conversation, if it's an exam, if it's a consultation that doesn't include a lab test, it is a free conversation with you. We don't gain anything from it. There's no upfront cost for it because we feel that you deserve that free conversation. And so if we always say, unfortunately, the hour is up, but please, if you have further questions when you go home and when you talk to other people, we encourage you to talk about what you learned here at 3W with other people because other people should be well informed and educated as well. But if you feel that we didn't give you the type of education you need for some reason, we always encourage you to come back and talk to another provider. We have 2 providers here at 3W. And even though there's a lot of similarities between them, there's also different backgrounds in education that maybe they can give you a different perspective on. And we encourage you to reach out to other medical providers that you know of, or other friends that could probably give a little bit more insight into whatever health questions or health issues that you might have. So that is so important, is to reach out to your community, reach out to people, and get more information because education and knowledge is power for you as a patient. So we really encourage you to do that. The 5th tip that this article talked about was research your options. I am so sick and tired of the medical system having cookie cutter solutions for complex, if not even, I take that back, not even complex situations sometimes. They think that because they only have 15 minutes with you, that you're like everybody else. I'm sorry, but the last time I checked, my body is very different from a lot of people that I interact with on a daily basis. So my health issues might not be the same or fit a certain structure that providers think is a good solution for me. So I always, my experience is like, after I'm diagnosed with something, after a provider suggests that I do this and that, I get online and I research the heck out of that topic. I get on, blog forums or the Mayo Clinic or ACOG or, peer-reviewed resources, but not peer-reviewed resources, just so that I can get a big picture. I'm a big picture person if you haven't picked that up, but so I can get a big picture of what this diagnosis meant or what this medication that I'm taking is going to help me or not help me, or how it's going to impact my body. So here at 3W, we are really big on I've seen it myself, my providers saying, I don't know what that means, but I don't know what the answers to that question just now, but I can research it for you. I have the resources. Let me get on the phone with some of my colleagues in the field who specializes in this specific issue, and let me get more data and information for you. We want to do that for you here at 3W. And I think that's very unheard of in the medical world. But you, as your own advocate of your own health advocate, I think should be able to reach out and do research and share your opinion about what you find. And here at 3W, we really encourage you to take that research into your appointment here and share it with our medical providers, because then we learn together as a community, right? Because there are certain things that you're going to see from your perspective that our medical providers can learn from, and vice versa. So I think that's such a great tip. Tip number 6 is don't settle for less. Oh my gosh. Before I was diagnosed, I want to say I've been through, 4 different physicians before I landed on one that actually took my symptoms seriously, took what I had to say seriously, took into account my morals and values, and was able to give me an answer. Especially with issues like PCOS, that's very hard to nail down sometimes and diagnose sometimes. I was consistently dismissed by the medical world. And I feel like I had to really, I took time off sometimes from looking into getting answers for my diagnosis, because it was exhausting. It was emotionally, mentally, spiritually exhausting sometimes. But I knew something was wrong with me. I knew that my body was not responding to certain medication or certain diagnosis correctly. And so I just did not settle. Just because these providers in the past had said, oh, just do this or do that, I felt like it was consistently a Band-Aid kind of answer to what I was feeling. And so I just did not give up. I just continued to reach out, have conversations with those that are in the medical world to make sure that I was not settling and thinking that I'm crazy. So I think that's a great tip. And tip number 7 is find support. Okay. I guarantee you that once I opened up to people about the different symptoms I'm having or the struggles that I'm having with medical providers, it was so wonderful to have the affirmation that I'm not alone, that the issues that I'm dealing with are shared in my community. And it's really frustrating, when your doctor's not listening to you, to know that there is a source of support out there. Gosh, there's so many Facebook groups out there. There's so many blogs out there. There's so many conversations now in this day and age that made me feel like these strangers knew what I was going through, and they were with me. There were some people that I could go to and talk to very candidly and honestly that didn't judge me for how I was feeling. And it's just helpful to know that there are people that are going through the same challenges with you, that you're not alone. I think with this day and age of technology, there are so many good things with technology, but there's a isolation that you also feel too through a screen. And, with COVID and the smoke here in Seattle, it has all caused a lot of difficulties to be together in person. And I think there's definitely something missing with in-person gatherings right now, and that's totally another tangent for another day. But I'm also grateful for technology because it does connect you to people from across our nation that could be feeling the same things and dealing with the same things. So I encourage you to reach out to people, find support in your community, because I guarantee you might not be the only one that's dealing with this. And it's very, very therapeutic to be able to talk things out with people sometimes. Or at least in my case, it was very, very helpful to know that I'm not alone. And the last one is so, so important. Tip number 8, so important. Don't give up hope. In a world right now that feels very hopeless sometimes, very dark sometimes. If you feel like your provider is not listening to you, it is very frustrating. It is so frustrating. I remember an experience once where this was my second time to see this provider, and it was the medical assistant that came in and said, okay, we're going to give you a PAP today. And I just had a PAP like literally 3 months before. And I stayed calm and I said, I don't think that's what I need to do today. And she insisted, she pushed back. And she said, no, we need to do a PAP today to make sure, everything's good out there. And I was like, can you just please double check my file? Because I'm pretty sure I sent you my PAP results a couple of weeks ago before I saw you. And she kind of gave me an attitude, which I didn't appreciate. But I stood my ground and I said, can you please just look at my files again? And if you don't have it in your files, I'm going to give my clinic a call to fax over this information. And sure enough, she looked again at my file and she said, oh, you're right. You did have it 3 months ago and we don't need to do one today. And, I just kind of let it slide and didn't push back any further. But that would have been another, I don't enjoy getting my PAP. Here at 3W, Dr. Rutherford is amazing. She explains every single time that she's going to touch me, on why she's touching me there, what the tools are that she's using, what the brushes are that she's using. So the experience here that you get at 3W with the PAP is very different, very positive from what you get elsewhere. But if I'm going to be really honest with you, no one enjoys a PAP, okay? I'm going to be real with you right now. No one enjoys a PAP, okay? And here at 3W, try to minimize the uncomfortableness, the negative side of the PAP as much as possible. And I want to say we do a pretty darn good job of that. But as a woman that has to do this, annually, every 3 years, every 5 years, it's never something we look forward to, okay? Let's just be real here. And I felt like, when I pushed back on that lady, I felt like, yes, I don't have to do this thing again. Yes, my insurance is not going to be billed for something that shouldn't have been billed for in the first place. I'm saving time. I'm saving waste. I'm saving, I'm being efficient. And she responded negatively to it initially, but because I stood my ground, because I stayed calm, because I was level-headed and knew about my medical history, I was able to advocate for myself successfully, okay? And I just want to encourage listeners to do that. Men, women, I encourage you to do that. And afterwards, I picked up the phone actually, and I called the receptionist of that clinic and I said, I just want to give you some feedback about my experience today. Because I think that medical provider, that CMA, learned something that day as well, to not doubt her patient when they push back and say, no, I don't think I need that today. I don't think that's something that we need to do today. I am in for something different. And I wanted to give them that feedback because all of us continue to learn, to grow in our field. And we, maybe that person was not having a great day. And we have those days, right? We have those days when we're not our best. But she needed that feedback, I thought, from one professional to another. So I picked up the phone and I felt comfortable enough to give her that feedback. So I encourage you to do the same thing. And I hope this podcast, this episode specifically resonate with some of you, because every time I bring up my experience, people, my girlfriends are like, oh my gosh, I had the same experience. Oh my gosh, I had the same conversation. And what would you do in those types of scenarios? So if there's one thing that I wanted to leave you with today's episode, with today's message, is that if and I think women are so intuitive, we have these gut feelings. If you know that the medical experience that you had was not great, was pushy, was manipulative, was coercive, that made you feel defeated, deflated, hopeless, you're not alone and you can do something about it. Okay? You're not alone and you can do something about it. And here at 3W, oh my goodness, it breaks our hearts when we get a phone call from a patient that is holding back tears or, have such a negative experience with a previous provider that they're just desperate. They're desperate to be heard. They're desperate to be in a place that they feel safe and heard. And they give us a call. And it's such an honor to be able to say, yes, we can book you an appointment. We can get you in fast. You will see a provider that respects you, that takes time, that does not profit from the reproductive choices you make. It's an honor to do that for our community. It's an honor to do that for you if you've experienced that here. We do not take those experiences for granted. So keep going, ladies. Keep pushing back when people are dismissing you, because you should not be dismissed. And, it's 2020, and women's health care needs to be a priority in our society. So once again, here at 3W Medical, we provide free reproductive health services. We approach women's health care from a holistic, patient-centered type of care. Okay, ladies? We take in all of your experiences, all of your issues into perspective. And that includes your mental health, your spiritual health, and your physical health. All taken into consideration. So if you'd like to give us a shot, if you want to come in and talk to one of our medical providers, you can find more information about us on our website. And our website is 3wmedical.org. And that's the number 3, letter W, then medical.org. Okay, I want to say that again, 3wmedical.org. It's a very easy website for you to navigate. We pick up the phone when you call. Send us a message. If you don't want to talk to us on the phone, that's totally fine. Send us a message via email. If you like what you're hearing on our podcast, please visit our website again. There's like a little tab that says podcast on there, and you can learn more about this episode. You can revisit some of our past episodes that are covering a ton of different topics that I think you'll be very interested in. And then if you like what you're hearing, please contribute to this resource. And that either giving me feedback, reaching out, giving me a call. I'm very accessible, by the way. Give me a call anytime via email. If you don't want to talk to me on the phone, that's totally fine. Message us on Facebook, and there's a section that says Ask Dr. Rutherford any healthcare questions that you have. Please do so. We really, really want to hear from you. And just want to wrap this up. So until next time, listeners, stay healthy and be well, and have a great Wednesday. All right. Thank you.